when you are keeping liver in anatomical position, this inferior border exactly should not direct downwards. It will be little projected forwards. You have to tilt it like this. It is directed downwards and forwards. So you have to keep like this. Visceral surface should be directed downwards, backwards and towards the left side. This is anatomical position. If you keep liver in anatomical position, there will be different surfaces, different borders. Right? See here, this is the surface which is present towards you. That means it is present anteriorly. This surface totally what you are calling anterior surface. Right? And this is the surface which is present above. It is in relation with the diaphragm. So this surface what you are calling superior surface. Then coming to the posterior aspect. See here, only this area is posterior surface. This is the inferior surface again. So only this area is posterior surface. Only this area is posterior surface. And what is this area? Inferior surface. Right? This surface is this surface is right lateral surface. Right? Lateral surface. So how many borders are there in liver? Only one border. One prominent border. Right? Inferior border. See? This border is inferior border. This border is inferior border. Right? Actually, inferior border is sharpest at the inferior part. When it is coming towards the right side, it is becoming the blunt. See? It is becoming blunt. This blunt border separating the visceral surface from the... What is this surface? It is not right lateral surface. But here, the sharpest inferior border separating the anterior surface from the inferior surface. At the inferior border, you can see one notch here. Actually, this is inferior border, no? Inferior border having here one notch and here one notch. This notch is for the ligamentum teres hepaticus. This notch is for the ligamentum teres hepaticus. And this notch is for the gallbladder. So this notch we can also call as cystic notch. This notch is cystic notch. This notch is notch for the ligamentum teres hepaticus. Notch for ligamentum teres hepaticus. Is it clear? Now, we will see what are the different lobes. Then we will go for relations. This lobe is right lobe of liver and this is the left lobe of liver. So anteriorly, right and left lobes are separated by this ligament. What is this ligament? Falciform ligament. This is falciform ligament. This falciform ligament separating anteriorly, but posteriorly, see here two fissures are there. Here one fissure is there and here one more fissure is there. In the posterior part, fissure for the ligamentum venosum. In the inferior part or in the visceral surface, fissure for the ligamentum teres hepaticus. So anteriorly falciform ligament, posteriorly fissure for the ligamentum venosum and fissure for the ligamentum teres hepaticus. So that we can divide the liver into right and left anatomical lobes. Right and left anatomical lobes. Within the right lobe, there will be two accessory lobes also there. This is one accessory lobe and this is another accessory lobe. Is it? So this accessory lobe, what we are calling cardiac lobe. This is cardiac lobe. This cardiac lobe bounded superiorly by what? It will be continuous with the superior surface. There is no specific border. Superiorly it is continuous with the superior surface. Is it? Then inferiorly or anteriorly. What is this? Porta hepatis. This is porta hepatis. This area is porta hepatis. And towards the right side, what is this? Fossa for the inferior vena cava or inferior vena cava. This is inferior vena cava, right? Towards the right side, inferior vena cava. And towards the left side, what is this fissure? Fissure for the ligamentum venosum. These are the boundaries. Superiorly continuous with the superior surface. Inferiorly or anteriorly, porta hepatis. Towards the right side, fossa for the inferior vena cava or inferior vena cava. And towards the left side, fissure for the ligamentum venosum. These are the boundaries. Then what are the special features which are present in this lobe? If you see below and towards the left side, here you can see one projection. This projection what we are calling papillary process. This process what we are calling papillary process. And if you see below and towards the right side, see this is a process which is extending from the caudate lobe to the right lobe proper. This process what we are calling caudate process. This is papillary process and this is the caudate process. Is it? So this is about the caudate lobe. Then coming to the quadrate lobe. This is a quadrate lobe. Because it is in quadrangular in shape. Right? It is bounded. If it is like this, what is this? Superiorly or posteriorly? Superiorly or posteriorly by porta apitis. Inferiorly by inferior border. Towards right side, fossa for the condylar. Towards left side, fissure for the ligamentum teres hepaticus. So this is a quadrate lobe. This is about the right lobe. In case of left lobe, also there is one projection. Actually, this is a gastric area. Stomach is located here. Is it? Just towards the right side of the gastric impression, or just left to the lower part of the fissure for the ligamentum villosum. Here you can see one projection. This projection, what we are calling tuber omentale. This projection, what we are calling tuber omentale. So this is the tuber omentale. Is it clear? Now, we will see relations very briefly. This is the anterior surface. This is lower part of the chest wall. That means lower part of the thoracic cage. It is present like this. Right? So this is the anterior surface. No? What are the relations here? See, this is the anterior abdominal wall. Here G5 process is there. Then what is this? Anterior abdominal wall. So anterior thoracic wall, anterior abdominal wall, diaphragm, G5 process. Along with thoracic wall, anterior abdominal wall and G5 process, there will be lung and pleura also will be related. That means right lung and right pleura, left lung and left pleura also related with the anterior surface. So when you are telling about the anterior surface relations, anterior abdominal wall, lower part of chest wall or lower part of thoracic cage, diaphragm, right lung, right pleura, left lung, left pleura, G5 process. These are the anterior surface relations. Then what is this surface? Superior surface. Superior surface relations means what? See, diaphragm. Diaphragm having two domes. This is the left dome of diaphragm and this is the right dome of diaphragm. This is left dome and this is the right dome. So when you keep it like this, liver is fit into the right and left dome of diaphragm. It will be fitting into the right and left dome of diaphragm. Is it? That means superior surface, this superior surface related with the diaphragm. Here right dome of diaphragm, here left dome of diaphragm, and in the central part there is a impression. This part is cardiac arch. Cardiac impression or cardiac arch. Over this, pericardium and heart is located along with central tendon of diaphragm. Here central tendon of diaphragm, over the central tendon of diaphragm, pericardium and heart. Here right lung and right pleura. Here left lung and left pleura. Superior surface relations, right dome and left dome of diaphragm. Over the right lung and its pleura, left lung and its pleura. In the central part, there will be impression. That impression is cardiac impression. It is related with the central tendon of diaphragm, pericardium and heart. Is it? So that is about the superior surface. Then coming to the posterior surface. See, this area is posterior surface. This is posterior surface. If you take the posterior surface, what are the relations? We will come from right side to left side. See, we have seen that this layer, what we are calling, what is this layer? Inferior layer of coronary ligament. This is the superior layer of coronary ligament. In between these two layers, this area, what we are calling, bare area of liver. So this bare area of liver is present in the posterior surface only. So bare area of liver, it is in relation with the diaphragm. Right? And what is this ligament here? It's a triangular in shape, present towards the right side. Right triangular ligament. Actually, superior layer and inferior layer united here and forming the right triangular ligament. Right? Then, in the bare area, towards the right side of the lower part of the inferior vena cava, this area is related with the right suprarenal gland. This area related with the right suprarenal gland. Then, coming towards the left side. What is this fossa here? Fossa for the inferior vena cava. So within the fossa for the inferior vena cava is located. Within the fossa for the inferior vena cava is located. So diaphragm, right suprarenal gland, inferior vena cava. Then cardiac lobe. Cardiac lobe related with what? We have seen celiac trunk, right and left truss of diaphragm, and it is in relation to the superior recess of lesser sac, inferior right phrenic artery. Inferior right phrenic artery. Of course, it is in relation to the vertebrae also. Okay. See here, vertebrae are there. It is in relation to the vertebra. Is it? So that is about the cardiac lobe. Then still more towards left side. What is this? Fissure for the ligamentum venosum. Within the fissure for the ligamentum venosum, what is there? Ligamentum venosum. It is embryological remnant of ductus venosum. It is embryological remnant of ductus venosum. Right? Then still more towards left side. Here, this small portion. This is the esophageal impression. This impression is esophageal impression. Is it? So these are the posterior surface relations. Now I will tell you only names. Diaphragm, right suprarenal, inferior vena cava, cardiac lobe related with vertebral column, celiac trunk, lesser sac, that means superior recess of lesser sac, and right inferior phrenic vessels. Then fissure for the ligamentum venosum, and within that ligamentum venosum. Then here esophageal impression. This impression is esophageal impression. Is it clear? So this is about the posterior surface. Then coming to the inferior surface. This totally, what is the surface? Inferior surface. This inferior surface related with will come from left side to right side, because esophagus continues as stomach. So this total area, it is related with the stomach. So this area, what you are calling gastric area. The lower part of the stomach is pylorus. This pylorus is related with the, what is this lobe? Quadrant lobe. Pylorus continues as first part of the duodenum. So this quadrant lobe related with pylorus and first part of the duodenum. So here gastric area, pylorus, first part of the duodenum. Right? Then coming to the fossa for the gallbladder. Within the fossa for the gallbladder is there. Then just towards the right side of the fossa for the gallbladder, here second part of the duodenum. Actually first part continues as second part. Here you can see the flexion, superior duodenal flexion. Superior duodenal flexion, second part of the duodenum. And there will be transverse colon also related at the lower part. This is about the up to fossa for the gallbladder. Then coming to this area here. If it is related with the suprarenal gland, what will be present here? Here, kidney. So this impression is renal impression. It is in relation with the kidney. Which kidney, right or left? Right kidney. So it is in relation with the right kidney. Right? Then here at the lower part, this part, it is in relation with the colon. Which colon? Actually it's a flexure. Colic flexure. Which colic flexure? Right colic flexure. Or we can also call as hepatic flexure. So these are the relations of inferior surface. I will tell you one more time, only names. Gastric area related with stomach. Quadrant lobe related with the pylorus and first part of duodenum. Related with what? Quadrant lobe. Then fossa for the gallbladder. Then here second part of duodenum. Actually here superior duodenal flexion. Here superior duodenal flexion. Then second part of duodenum. Then renal impression, colic impression. These are the relations of visceral surface. Then coming to the right lateral surface. This is the right lateral surface. Now again we will keep this in the anatomical position. So here, first there will be diaphragm. We are dividing this into lower part, middle part and upper part. If you take lowermost part, only diaphragm. Middle part, pleura and diaphragm. That means costodiaphragmatic recess and diaphragm. And if you go little up, diaphragm will be there, pleura will be there, and lung also will be there. Right? So in the upper part, diaphragm, pleura, lung. In the middle part, diaphragm and pleura. In the lower part, only diaphragm. These are the different relations of right lateral surface. Then what you have to discuss here, one more thing we left, porta hepatis. Right? So this is the porta hepatis. It will be having the two margins of porta hepatis. This is the posterior margin of porta hepatis and this is the anterior margin. This is the anterior margin of porta hepatis and this is the posterior margin of porta hepatis. both are continuing towards right side and becoming the lesser momentum. Is it or not? And this lesser momentum will be attaching to the fissure for the ligamentum venosum and also margins of the porta hepatis. Right? Within the porta hepatis, what structures are present? From posterior to anterior side. What is this? Portal vein. This is portal vein, and this is bile duct, and this is the hepatic artery. These are the structures which are entering and leaving. Actually, if you wanted to say exactly what are the structures entering, portal vein is there, hepatic artery and hepatic flexus. That nerve plexus are there, no? These nerve plexus are entering. What are the structures leaving? Lymphatics and bile duct. So these are the gross features, and remaining blood supply and all we have discussed in the theory session. That's it for this session.